congratulate you on your first hearing here. I would remind all that you served with me on the tax subcommittee, and it was very clear that you decided your future would lie in the health subcommittee after that. Mr. Chairman, I'm pleased that we are holding this hearing to identify solutions to address the opiate abuse and dependence, specifically in the Medicare space. Although overdose rates are highest for people 25 to 54, this public health emergency also affects Medicare beneficiaries. Everyone in this room has a family member or knows someone directly impacted by the opiate epidemic. It could be somebody down the street, it could be somebody in the next room. In my home state of Massachusetts last year, there were 2,094 confirmed opiate-related deaths due to abuse. I thank my neighbor to the north, Governor Scott, and his health secretary, Gobay, for joining us today. We share a border, and it also means that we share a common challenge fighting the opioid crisis. Massachusetts Governor Charlie Baker, like Governor Scott, is working to employ all tools in this fight, ranging from expanding Medicaid coverage to provide treatment availability, data analytics, and treat addiction while stabilizing and supporting families. Opiate abuse and related deaths take a toll on all of our communities and on all of our families. There is no single cause, and there certainly is no single solution. Expanding Medicaid under the Affordable Care Act to low-income working Americans who previously could not afford insurance has been the most significant step in recent years to stem the tide of opiate crises. Providing access to critical substance abuse and mental health services that previously were prohibitively costly has also worked. We need to look to Medicare beneficiaries' ability to access treatment, as oftentimes providers aren't available to meet the needs. We know there are significant gaps in coverage and access under Medicare. For example, Medicare does not cover outpatient treatment programs that provide comprehensive opiate addiction treatments, nor does Medicare cover methadone for addiction, which is often the treatment of choice for longer-term addicts. I recently introduced legislation that would allow methadone to be covered for outpatient services under Medicare. We also need to work with our partners to identify best practices. Late last week, I sent a letter to the Energy and Commerce Ranking Member Pallone about 14 Medicare plans and to ask them to help compile the best practices that they're aware of to address opiate-related disorders. Evidence-based tested activities that are helping patients turn the corner will help us design sound policy. I look forward to these plan responses, and I hope Dr. Paz from Aetna today will share his knowledge about what they're doing as well. We also need to explore how substance abuse is affecting children and families. The epidemic is fueling a rise in caseloads for children and adult protective services, for foster care, and also for caregivers as they attempt to battle addiction. I'm pleased that our committee has worked together on this bipartisan basis on legislation to support families and to help them keep children safe who would otherwise be in foster care while they can now remain safely at home with proper monitoring. We hope we can continue this partnership because we have much work to do. I hope that as we move into the following year, that we will not endorse or embrace plans to cut efforts that would in fact undermine what we're attempting to do here today. For example, the Social Security Services Block Grant is the largest source of federal funding for child protective services and the only major source of federal funding for adult protective services in most states. We have a lot of work to do, and Congress could play a positive role in partnering with the states to provide resources and hope to eliminate federal barriers to treatment and access and support families and law enforcement. And Mr. Chairman, to you for holding this hearing, appreciate it. To also point out something that you and I have talked about a number of times. There are now 2 million people on the sidelines who formerly were in the workplace battling this epidemic. And when you look at labor participation rates, it has had a huge impact on what has happened. So this is a very important hearing. Thank you.